here we go. Scars act as interference fields. And what interference fields are, it literally blocks energy flow. Scars have different electrical activity. They can mess with the meridian pathway, which are the energy pathways. We don't know if it's under the skin, on the skin, or above the skin. But those scars, like, they just really change the structure of skin. So when the body injures itself, or when you get cut, when I said not injured, so when it gets cut or damaged, these sympathetic nerve fibers may heal poorly, disrupting the overall function of the area and causing a chaotic and noisy sympathetic area. And according to Dr. William Hushang, he refers to scars as an island of turbulence in the area. And so I always encourage people, find a doctor that knows about scars, because disease in it is an energy blockage that I think is enormously interfered with by scars. And so scars harbor emotions. And when you release them, it literally helps to liberate all of this energy in the sympathetic nervous system. So if you've had, again, a broken bone, a really bad cut, a mole removal, a surgery, I'm going to tell you guys right now, one of the best things that you can do for that is to take wheat germ oil, if you're not allergic to wheat, or vitamin E pearls. And so the pearls, I mean, this is an exaggeration, but they're these little black pills, and you just come in and you hit them with a needle, and you pop it, and you can rub them over the scars. That's a really, really good way to help scars from a distance. Now, the best way to work on scars is to inject them with a glycolized ether of para-aminobenzoic acid, which is a sugar-fied B vitamin, because it makes the nerves hyperpolarize and depolarize and repolarize. And so the treatment effect that we have on that is something called Segunda phenomenon, which obviously is German, but it's Dr. Huneke came up with that. And Dr. Huneke got to go down in history of one of the most amazing physicians ever. He recognized scar therapy, and they practiced in Germany from the 1920s to the 1940s. And this scar formation, you got not only electrical thing, but you have adhesions that attach to deeper sliding structures in the tendons, muscles, and fascia. Another famous doctor, Dr. Jean-Claude Guibarteau, showed scars and adhesions observed during surgery. And among these fascinating clips, he showed that the adhesion from the skin scar restricting the sliding motion of a tendon. There was also ovarian adhesions from a C-section scar. And so what scars do is it constitutes the natural repair of the body or wound with dense fibrous connective tissue. It's not the same type of tissue. And with the collagen, the inferior function of that area, it's never as healthy as normal tissue. And so it has a tendency to restrict motion. It causes physiologic changes, and then it affects the nerves, the blood, the lymphatic vessels, meridians, skin, fascia, and basically everything that connects over that scar area. We also know that the scars vary in temperature and electrical resistance. They literally have an electric signal about 10 times higher than normal skin. And it may be a direct pain generator, and it can affect deeper tissues, the neuromas, the nerve entrapment, inflammatory problems. And when it stops the natural flow, it has something called fascial drag. So the fibers are supposed to slide on each other like this. Well, when it gets scar tissue, it doesn't move. And I know this from my scar here on my collarbone. I broke it 2 years ago. I did a flying Superman over my handlebars and broke my my clavicle in 7 places, and ended up with a plate and some screws in it to basically stabilize the area. It feels so much different than this side. Now, I've done a lot of injection work on it and liberation work. I've rubbed the MSO and vitamin E and wheat germ oil on it. It's so much better, but it's not quite the same. But I don't feel that the problems with it as I felt before. Scars refer pain. Dr. Upliger and Dr. Vervigud gave an example of chronic migraines produced by an appendectomy scar. One of the most amazing success stories I've ever had is I had a lady that came in that had 6 back surgeries and chronic pain on pain relievers and opioids. And I tried everything I could think of. I tried acupuncture, we tried infusion treatments, we tried diet, we tried a whole bunch of different things. And out of desperation after, a couple treatments where she wasn't making any progress. I said, "Where does it hurt?" And she literally was like, "Right here and right here." And she'd pointed to where she had had a lipoma removed. Lipoma is a benign fat accumulation. And so they went in, they did a little incision, they pulled out this kind of, it's almost like a rubber ball of connective tissue. It's a benign tumor, so it's not cancerous, but it can accumulate. She had those scars there, and I'm like, well, we should try this. So we treated her scars. All of her back pain went away. I really think that she might not have needed surgery, um, because of because it was a referral pain from those scars. When the scar, as sometimes if you press it wrong, the conditions can get better or worse, as in the case with the headache. And when he would push it one way, it would cause a migraine. When she pushed it another way, it would go away. And so in the book, The Neural Therapy, which I quote all the time, a local disturbance may cause symptoms unrelated to distal sites. And so, like, you can have scars in different part of the body that can have a huge impact. You can have a knee scar that can cause lung problems. You can have a back scar that causes arthritis in your feet or circulatory problems. And even though it doesn't appear to be connected, it can have a massive impact. Another thing that I learned in the study is that when people have a right or left side pain, like if their symptoms are, oh, I'm on the left side, or everything that happens to me is on the right side. I've got arthritis on the right side. I've got a rash on the right side. It's an interference field. Many times you can trace it back to the tonsils. So the tonsils removed, you have a tonsil scar in the mouth, and it literally shifts the body energy to one side or the other. You can liberate those tonsil scars, and a lot of one-sided pain will go away. Okay, the clinical assessment, obviously looking at the scars. Is it laparoscopic? Is it tonsil, episiotomy? Sometimes circumcision scars. I've had some good results with those, with male health problems, and episiotomy scars with chronic pelvic inflammatory disorders. And looking at the characteristics of the scar, a post-mastectomy scar, a non-tender scar may still cause problems. And then in the textbook Naturopathic Physical Medicine, deep palpations of the scar, it has a specific feel to it. And so you got to feel these scars, and sometimes they aren't painful, but they can cause problems. And so it's always beneficial to look at scar therapy and looking at the different things. There's acupuncture considerations, there's myofascial release technique, there's Graston technique, there's vitamin E. I like DMSO, it stands for dimethyl sulfur oxide therapy, and neural therapy involving injections of either mannitol, dextrose, procaine. I love the treatments of wheat germ oil. Chlorophyll ointment is another really good one. Vitamin E, as long as it's a good natural source. Considerations to scoff deep tissues, like, a C-section scar or a glutathione or dimethyl sulfur oxide. But it's one of the best treatments available. So when I got asked the question, hey, Dr. West, what's the deal with scars? I wanted to go over this presentation and tell you, like, there's things that you can do at home. I love, my favorite way to treat these is PABA, which is paraminobenzoic acid. And again, it makes the nerves flush. And it's literally like having this computer reboot. Like if your computer's not working right, we call it tech support. And we say, the computer's not working, tech support frequently, and say, turn everything off, turn it back on, reboot the system. That's literally what can happen with scar therapy. And being able to use the principles of physics and electricity, it's one of the most important things that I've learned in practice. The first time I heard about it was in 2004. I had a patient come in that said, I got some scar therapy in a clinic in Reno, Nevada. It really helped my back pain. You should look into it. That led to me looking at how we can do therapy. Also how you can do a non-injection therapy. So you guys, one of the best things we can do is using something called cold pressed castor oil. So usually people use it to get people to throw up, but castor oil is such a wonderful universal softener. You can get it literally about any grocery store, any drugstore, and it's so helpful for liberating some of the trapped energy with scars.